to the Healthy Living Show. I'm here with Dr. Claude Tolbert, and we are standing at the entrance to the Women's Pavilion at Coastal Carolina Hospital. We're going to take a little tour, show you behind the scenes, so that you can see where women come and what they experience after they've had a procedure here, as we discussed earlier in the segment.
Absolutely.
So thanks for the tour. Let's head on in. So we're coming into the lobby, which is where we were talking earlier. And you know, this is an area where I'm sure a lot of joyful times happen, right? Because babies are born here as well at the Women's Pavilion, right? So in addition to bringing in new life, you care for people of all ages.
Right. We've tried to make this unit a very comprehensive unit that pretty much exemplifies the care that's needed for women's care. So not only do we specialize in birthing, but we also have specialized nursing care for women who need certain surgical treatment and post-op care. Okay. And so they're taken care of very well here on our Women's Pavilion.
Okay. So we're getting back to the area where the nurse's station is and actually walking onto the unit now. Now, one of the things that Coastal Carolina Hospital recently celebrated is this as a designation by the Advanced Institute of Minimally Invasive Surgery, and that's a center of excellence in gynecological surgery.
Correct.
Tell me a little bit about how the hospital got that designation and what that means for the community.
Well, to be quite honest with you, a hospital the size of Coastal in Hardyville, to get that designation is quite outstanding. In order for us to even get recognized, we had to be able to show that we strive to maintain minimally invasive surgeries. There's 75% of all cases should be accomplished minimally invasive with a very low complication rate. We've been we actually did much better than what the minimal criteria was. We have a significant number of our cases are done minimally invasive. We have a very comprehensive program here, not only gynecologists, but we have urologists, general surgeons, and we're able to accomplish major surgeries in a minimally invasive manner. And we were actually given that designation and received site from the Amos Institute for doing so. It was kind of a rigorous process. They actually came in and actually proctored our cases, or pretty much watched our cases to make sure that we were doing our best as a team, not just the physicians, but the OR staff as well, that we worked well together, and that our practices were a certain standard.
So what you're saying is that it's not an everyday thing that people get this designation, and to have it right here in this community is something that's really special, something people might not get everywhere.
It's very special. That means that our community, our citizens of our community, they don't have to travel far to get those problems that at one time you would have to go to like a academic center like Charleston or Savannah per se to get the level of care that we're offering here.
Okay, and you know, I know that in addition, so it's a team effort, and the hospital as a whole was recognized as a center of excellence. But in addition to that, you as an individual surgeon were recognized by the Advanced Institute of Minimally Invasive Surgery. Tell me a little bit about that.
Right, so it's also part of the program of getting certified as a minimally invasive surgeon and to get that designation. My surgical transcript was pretty much scrutinized extensively to get an idea of, well, how many cases have you done, and of those, how many were minimally invasive. And I'm proud to say that more than 95% of my major abdominal cases are minimally invasive, gynecological cases, with a very low complication rate. So that was quite an honor.
Quite a feather in your cap. That's great.
Yeah, it is. This is a niche in my specialty that I've really grown to enjoy. And I've spent extensive time in training and courses in mastering the skill of minimally invasive surgery.
And master is a key word, because I think that you and I have talked before, and you're actually designated as a master trained Da Vinci surgeon, is that right?
I am by intuitive. I have achieved that status by extensive training and and also case performance. I have received a designation as a master robotic surgeon.
How many robotic cases would you estimate that you've done?
Oh my God,
Thousands?
I have no idea. That's almost asking me how many children have I delivered. I just don't know. I'm afraid if I took the time to actually count it, I would realize that I'm pretty old.
But
so I am better off not doing that.
Well, we can be rest assured that women are in good hands, though, in the care of your hands, right?
Yeah,
okay,
we
good.
do our absolute best.
Yeah. Well, let's take a look at one of the patient rooms here at the Women's Pavilion, just so we can see what it's like. Let's head on in. Now, I like the little touch of the swans here. Gives us a little feel of a hotel almost.
Right, so our whole unit is designed with the patient in mind. Number one, we have ample space in this room. And also, we also have a courtyard for our patients to enjoy.
Okay.
And so it's actually, I always often tell patients, it's like somewhat of a retreat that's pushed off to the side of the hospital. Mm-hmm. And it's made with our patients in mind.
So, you know, when you come to any hospital, anytime, it's not exactly what you'd like to be doing that day. So it seems like maybe there's an effort here to have a special touch so that you at least feel a bit of that warmth and individuality and caring.
Absolutely, and it's not so much the hard infrastructure, it's more so the care from the nurses. I'm always amazed when I see patients in the office post-operatively and they will tell me how much they appreciate the care from the nurses and how vested the nurses were in their recovery. Mm-hmm. That's always encouraging. And that's one of the things that's pretty consistent here at Coastal. Mm-hmm. You get that one-on-one care, and you get someone who's really interested in getting you out of here as quickly as possible, mm-hmm. and making sure that your recovery goes well.
So you get good expert care while you're here, but then you get to go home quickly, which is where everybody wants to be.
One of the benefits of the minimally invasive surgery is that you're able to get back to life as quickly as possible. We don't want you staying here in the hospital. About
how long do women stay in the hospital after a surgery?
They typically go home the very next morning.
Oh my goodness.
The very next morning. There have been some minimally invasive surgeries I've done, myomectomies, and a couple of hysterectomies where patients were motivated and wanted to go home that day. We work very closely with anesthesia as well to make mm-hmm. sure that post-operatively these patients' pain is well controlled. Mm-hmm. We've implemented, it's called ERAS, which is a program that is done at the front end of surgery to help control pain, reduce the need for narcotics, and to get patients up and moving about and get bowel function going. So we're doing everything here at Coast to make this minimally invasive program work for the patient.
So everybody wants pain controlled, right?
Right.
And so are you saying that that's actually a process that we think about from the beginning to make sure that all those steps are in place?
Right.
So everything goes right.
It's a process from the moment you are registering to the moment you leave. We start educating you on your options for pain. We also pre-medicate you for pain. That studies have shown it lessens the need for narcotics, and you'll be surprised the number of women who have had robotic surgeries here. Oftentimes, many of them will only take Motrin. We actually send them home with more than that, but that just gives you an idea of how minimally invasive surgery has lessened post-op pain for a lot of patients.
That is impressive, and that's why it's so important that so many women can get that surgery now. So about how long after, I realize everybody's individual, but when you do go home, how long before you can get back to doing your normal activities?
So, you know, I recall distinctly, I've done this robotic surgery, hysterectomies on 2 truck drivers. They didn't know each other. But I recall telling them no work, no driving for 2 weeks. Well, by the time they had come to see me 2 weeks later, they both had started driving their trucks.
They felt that good, huh?
They felt that good. And more women I see, they take it upon themselves to resume their activity. You know, you tell them, nothing for 2 weeks, come see me in 2 weeks. But they're very independent. I gotta keep life moving.
Okay.
And I found that most women, by that second week, they're pretty much doing very much what they were doing before. And then between the second and third week, most women are back at work.
Well, yeah, I think that hearing these things hopefully will help to dispel some of the concerns and the myths. And I also think it's nice to hear you just talk about what's done every day, because these pelvic health problems, I think women are sometimes nervous or embarrassed to talk about.
Absolutely.
And what we need is to know that you handle it. It's normal to you to talk about
It's
it,
normal.
right?
It's normal.
Let's reassure our audience.
Yeah,
that
it's absolutely
no
normal.
need to be embarrassed.
No need to be embarrassed, but that is one of the obstacles I've noticed, that is for patients to overcome that initial conversation. And I personally think that any good gynecologist will pry a little bit when examining a patient and taking a history to see if there are issues.
Okay.
But you're right. For some patients, it is difficult to bring that subject up.
So the most important thing is to start the conversation.
Start the conversation.
Thank you for joining us today on the Healthy Living Show.